to test for coronavirus antibodies is growing, but what we can do with that information is still limited. I found out what you need to know about antibody testing in this week's You Ask, We Investigate report. Antibody testing is an emerging tool for dealing with the COVID-19 pandemic.
I think in the coming weeks to coming months, it'll have a lot more value than what it does now.
So what exactly is an antibody test?
We draw blood and check to see if there's an antibody present.
The presence of them most likely means you were exposed to COVID-19.
The antibodies are not produced right away. They take days to weeks to develop. So if you're testing to say, am I infected, it's not a good test. Is it a test to say that I have been exposed in the past? It is.
Dr. David Ratcliffe is the chief medical officer at Washington Regional Medical Center in Fayetteville. He says a positive antibody test does not guarantee immunity.
With regards to COVID-19, unfortunately, at this point in time, we really don't know whether antibodies prevent against infection, and if so, how many are required to prevent infection.
So why should you get a test?
It's somewhat important now because if we have individuals that we can show that have been exposed to the virus, either they're asymptomatic or they recovered from a symptomatic illness, then we can identify those that may be donors for convalescent plasma.
Dr. Ratcliffe says the plasma can potentially help patients suffering from the virus.
There's some really good data now that says that convalescent plasma, antibodies from a recovered patient, can be helpful to someone who's acutely ill.
Quest Diagnostics is currently the only place offering antibody testing in Northwest Arkansas, but there will soon be another place for you to receive one of these tests. Namita Lab is a biotech company in Fayetteville. Its scientists have worked hard over the last several weeks to develop an antibody test for Northwest Arkansas. The company is equipped with a fully automated laboratory that can run up to 3,000 samples per day.
So it has been a whirlwind of testing, building knowledge, and our team essentially has gone from zero knowledge in this space to being an expert and one of the first to bring out a test in 6 weeks' time.
The company is hoping to begin testing early this month. It will initially only be available to healthcare workers and large corporations. Now, if you would like to get an antibody test, you are encouraged to speak with your doctor first. If there's something in your community that you want to know more about, we want to investigate it. Send your questions to me at the email address on your screen or on social media, and watch KNWA every Wednesday to see my You Ask, We Investigate report.